Welcome to the Science of Life podcast, where we dive deeper into the topics of nutritional science, Ayurveda, yoga, and personal development. Hello and welcome to another episode of the Science of Life. I'm super excited about this interview. I have Carolina with me, who is an osteopath and functional medicine practitioner. And so today we want to talk about the microbiome in detail. And before we start, I let you introduce yourself a bit more to the listeners. So welcome to the podcast.
Thank you, Dania. Thank you for inviting me. And I'm super excited that we have a really special subject to talk about. And that's super important nowadays and comes a lot into the mainstream. So as you said, I'm osteopath and functional medicine practitioner. I specialize in metabolic conditions that influence, for example, the gastrointestinal tract. And I work with the patients one-on-one. I've been working for almost 9 years already. And I'm super excited for our upcoming talk.
So before we get a little bit more into the details, I wanted to say a few things for those who are listening and asking themselves, what is the microbiome actually about? So we have a microbiome that is specific for certain parts of the body. Today we're going to focus on the gut microbiome. So there's a microbiome on the skin, and basically what microbiome says is the whole of the bacteria that live, for example, in the gut, and they form functional entity, and they help us to digest, for example. They do a lot of other tasks that support our immune function, our health. Maybe we can start a bit from there if you want to add something like that. What is the gut microbiome? What is the use of it actually? And what is a healthy microbiome?
Yeah, so as you mentioned, we have different kinds of bacteria living in our systems, and we're going to talk about gastrointestinal microbiome today. So basically the microbiome that's placed from our stomach to our colon and intestine. Small intestine, and that's also connected with our nervous system. What is super important, and what is also very important, is that it's 75% of our immune system. So basically the mucosa, the mucosal barrier, and immune system are in a constant talk and discussion that will influence our immune functions. Then, as I mentioned, we have this gut-brain axis. So basically the path of neurotransmitters that will influence, for example, our mental health, our reaction response to stress. So we will cover that. As I know, you've studied a lot of microbiome for your PhD, so we will talk also about a little bit about the different types of different kinds of bacteria. And what is also worth to mention is that our metabolism, it is actually our bacteria metabolism, because the work they do will influence how we react with our functions, especially with the gastrointestinal functions.
It's so interesting, and when we talk about a healthy microbiome, I think a lot of people have the idea that there are good bacteria and bad bacteria, and I want to go a little bit into that, because that's actually not the case. It's more about a balance, right? So what are the good bacteria that we could say and what are the bad bacteria, but why is it important that we need all of them?
Yeah, so as you said, there is no one receipt for a healthy microbiome because it's all individualized. But what can be one hint for the healthy microbiome is that is very diversified. So this is what we want to achieve when talking about healthy microbiome, because most of the societies nowadays, westernized societies, high developed one, suffer from low amount of bacteria. And this is what causes so-called dysbiosis, so disbalance in the gut microbiome. And then what you mentioned, we can talk a little bit about good and bad bacteria, but it's more about the lack of some kind of species and the overgrowth of other ones. And also different species of bacteria will influence different functions in our system. So as we mentioned, for example, the mental health, there is a big influence found in the research on of Akkermansia bacteria on the mental health and how it will influence our nervous system function. Then, for example, the Rhamnosus species that will influence our immune system in a big amount. Then the disbalance of some kinds of lactobacilli and bifidobacteria when it comes to different types of disease, as for example SIBO, that we will also cover today. So this different kinds of disbalances will cause different kinds of symptoms and different kinds of disease. That is, for example, the inflammatory bowel disease, or mentioned SIBO, or colitis. And so we want all the bacteria, we want them diversified, but we want to have the balance.
Yeah, super important. And what are the main influences that actually change our microbiome or lead to a disbalance, and how can we restore it?
Yeah, so as I mentioned just now, we are lacking a lot of bacteria. So because of the hygienic system in 21st century, especially during the pandemic, where we started using even more sanitizers, etc. So it caused diminishing of some of the types of bacteria. And how we can influence that is, for example, just be exposed to dirt. And for example, spending time with animals is a good way to influence, to get more of the bacteria in your system. What causes also the gut bacteria deficiencies are, of course, different types of xenobiotics, antibiotics, especially the ones of the broad spectrum of use. So they cause a big diminishing of the gut bacteria. Then stress. Different kinds of stress, so psycho-emotional stress, but also the stress connected with the amount of toxins that we are surrounded with, both internally and externally, as for example air pollution, right? So for the system, for the organism, stressor is always the same one, so it doesn't change for the organism answer, whether it's psycho-emotional stress or mentioned air pollution stress, but our autonomic nervous system that actually innervates the gut bacteria as well, so-called the enteric nervous system, that innervates particular particular parts of colon and intestine will respond will have a stress response. And this will cause the change in the microbiome. Also, the biomechanical changes that we will also talk about. So different kinds of biomechanical dysfunction. So basically like different types of tension on the structures, on the internal organs, especially on the small intestine and the colon, but also on the stomach, diaphragm, and so on, will change the amount of the species that we have. There is also a lot of research now that cover influence of the different type of dysfunctions in the different types of structures, internal organs, on the amount of the bacteria species. So we can influence bacteria in a good and in a bad way very hugely.
Yeah, and I think it's also important to say, during the pandemics, we used more sanitizer. The good thing is also more people got pets. But we have to use, we have to implement a certain time of hygiene, so it's important to wash your hands with soap. It's important at some point to take an antibiotic, so I think it's more about like restoring the balance, and so for example, if you take an antibiotic, it's still good to check whether it's like a broadband antibiotic, or if your doctor was just aware enough to target, a certain kind of bacteria with a certain type of antibiotic. I feel like that's so important in like a patient-doctor communication to double check with that, and to ask for that as well, to do certain testing. And then, you have to take it, right? And like antibiotics are also important at some points and can save life. So what to do if we had to take an antibiotic, for example, or we know that we had to do certain things that like upset the microbiome, for example, as you mentioned, antibiotics, taking medicine that has an influence on the gut microbiome. What do you recommend, for example, after taking an antibiotic?
Yeah, this is important what you said also about physician-patient communication, and to have a physician that you trust that will focus maybe more on the root cause and focus more on the detailed, maybe on the acute state or acute inflammation that you have, and maybe do some testing for the specific kind of antibiotics, do the so-called antibiogram. But then like meds, as you said, are important, that can save life. Pharmacotherapy is what's been on for years now, and this is why we have, for example, a better lifespan, right? But of course they have different kinds of side effects, so but we have this choice that we can support both the side effects and support the medicine, different kinds of medication to work better actually. So for example, while taking antibiotic, it is not only to secure the side effects but also to support the antibiotic to work its best for us. So of course the diet is the number one, obviously. So while taking antibiotics and any kind of medication, it is always super important to support our liver with her function, and then the pancreas with the certain types of diets, with the certain types of fatty acid, with the small amount of kinds of carbohydrates. Then pre and probiotic foods, right? So prebiotic foods are the types of foods which feed our bacteria. So this is like the food for our bacteria. and this is very important to eat it, especially before, in big amounts before the medication therapy or antibiotic therapy, then during taking it, and after. Then probiotic food. So probiotic food, for example, different types of fermentation food, these are the foods that actually have different species of bacteria in it. So maybe it is not always necessary during the antibiotic therapy to be taking probiotics in the capsules, but it's enough sometimes to just take the foods that include probiotics, as for example like sauerkraut, natto, tempeh. So yeah, and then what I recommend often to my patients is specific types of probiotics that are dedicated to take after antibiotic therapy. So that will support, they're usually actually the probiotics that are recommended also after different type of abdomen surgeries. That also is the mechanic influence into your gut bacteria. So I suggest, as with any kind of pharmacotherapy, so prepare yourself for it. So all the things that you can do before that, then during it, and then after. So like we have these 3 levels of support.
Yeah, and as you mentioned with the prebiotics, when you look at like Western nutrition, like they are lacking, like a lot of people don't get their intake on fiber, so prebiotics will be foods that contain especially soluble fiber, like flaxseed is a good choice, or psyllium, but also you mentioned complex carbohydrates, that contain a lot of fiber and give our bacteria the food that it needs. So these were already, very important tips how you can improve or be more conscious about like taking antibiotics and then restoring the gut microbiome. You mentioned a test, like first, maybe a lot of people are now interested, like how does my doctor test for like certain kind of bacteria or what antibiotic to give? And the other one, which are tests that are valid to get like an insight into the current state of your microbiome?
Yeah, so when it comes to gastrointestinal health, we have certain types of testing that we can do. Of course, everything depends on our symptoms. So what a good physician, medical professional is obliged to do is to go through the patient's detailed history and the history of the symptoms, and then check on what tests will be valuable for this kind of patient. And of course, blood testing is the first and the simplest thing we can do when it comes to any kind of testing, because it will show us whether we have some kind of systemic inflammation that can be a cause and the reason actually for different kinds of gut inflammation that can be going on in our body. We can test for different kinds of micronutrient deficiencies. For example, deficiencies of certain types of vitamins, for example, vitamin B, folate, iron, and so on. That will lead us to know that, okay, these types of minerals, vitamins, are super important to our microbiome. So if we lack them, then there is a big chance that our gut microbiome cannot be as efficient as we would like it to be. So yeah, blood testing is the thing that we can do just by ourselves. We don't need even a physician for that. I like, for example, on my website, I have this list of the basic blood tests that you should do like every year to test on your overall health. Then when we have some indication that something's going on with our gut health, we have different kinds of microbiology testing. It's quite a new thing, actually. So like this microbiology science that's been going on around microbiome, that's been going on for around 15 years now. It's like super new, right? So still, when it comes to probiotics, we know almost nothing because it's such a new branch of the research, of the science, medical science. But we're getting there. We're learning more and more, especially in correlation to epigenetics as well, and how different kinds of bacteria and the disbalance in the bacteria influence our gene expression. But this is a little bit of a different topic, but it's important to mention that. So we can test on different kinds of species and their colonizations, so the amount of them in our intestine through the different kinds of stool tests. We can test for bacteria, but we can also test for yeast and parasite. And we can also test, for example, for immune markers, inflammation markers, as for example zonulin or calprotectin. So we can test on the gut permeability and the gut barrier efficiency. And this is made in the special laboratories. And there are not that many of them yet, as for example for the regular blood test laboratories, but they're there luckily, and they're available, not that expensive anymore. So this is also important to highlight that most of us can easily afford that, and it is important to check on it because 96% of Western societies have these biases nowadays. Then when it comes to modern gastroenterology and the diseases of the gastrointestinal tracts that we already mentioned a little bit, for example, IBD or colitis, but also different kinds of colorectal cancer that are going on now, and it's like super common, unfortunately. It is important to do the colonoscopy, especially when you have the history in your family of colorectal cancer. So not even to do it at age of 50 or 45, but maybe 35 when you have this history in the family. So yeah, we have these different kinds of testing. I always recommend to the patients to start with the most simple way. Of course, the most important thing that we should test on a daily basis is our body awareness. So if we are aware enough on what's going on in our body, we can see the red flags that something's going on. Like our skin is this red flag. And this gastrointestinal discomfort, like the belly discomfort. So many people nowadays just got used to feeling bad, feeling bloated, having like diarrhea or constipation on the daily basis, having nausea, having reflux. And no, it is not the healthy way for your everyday living. So if you see these red flags, go check on the blood tests, go to see a medical professional. It can be a functional medicine practitioner, it can be a good gastroenterologist, or maybe just a good GP that is aware of what's going on in the GI disease world, right? And then provide the specific like stool test, blood test. We have also, for example, the breathing tests for the methane amount, for the SIBO, SIFO, IMO. So yeah, there are different types of testing we can do.
Yeah, it's so important. You touched on so many things that I want to take up on. And first of all, a lot of practitioners learned the old way. Like a lot of doctors, they like back when they studied, this was not like as developed, or like not even the idea of a microbiome was present, so I think it's so important, like, not to give up just because your doctor says, like, he does like a simple blood test and then he thinks everything is fine and sends you home. No, educate yourself and maybe get the help of a functional medical practitioner or someone who can support you, tell you what tests are necessary, and then you can work together, you can work together with your doctor who can take the blood and like do the test, or there are also nowadays more and more institutes that do the test where you can just like send your sample in, like your stool sample. It's very important to pick the right institute and laboratory, because with these tests a lot of things can go wrong, so the sampling is very important. The method of looking at the stool and like how it's processed, that's important. Basically I would say, because I get a lot of clients who come and are just like frustrated, because like the doctor doesn't do the test or think it's not necessary. So get help, and also be aware that like even though you have like a stool test, not everything can be visible, as it's just like basically it cannot show you exactly what's going on inside of your body, because you have transient bacteria and you have bacteria that like live in your gut. So it can show you something with the stool sample, but it's also, very important to just see that as like some kind of hints. And what you said, what is so important is to test for micronutrients in the blood. For some it's not possible, like calcium, the blood test will not give you like a good mirror of what's really going on, but for some it's possible and it's valid. And I see so many patients, like not only when I look at nutrition protocols and run them through a software, like that they not even take up the nutrients that they would need on a daily basis, but then also when it comes to blood testing, how many micronutrients are actually lacking. And we expect the body to function without proper fuel, and this is also something I wanted to highlight. And it's not about like taking supplements, as you said, it's like so important to take up these nutrients as much as we can through a healthy diet. And maybe also we can go a little bit more into a topic we touched already. It's probiotics in a pill, because for certain imbalances in the microbiome, like certain probiotics are more important. So it's not about, blindly taking any supplements. I see that with a lot of supplements for micronutrients as well. Like people just think they could use it, why not? It's good, so they just like take it. And then sometimes I also see like very high values in the blood samples, and like it's all a balance. It's not about the more the better. No, it's really about restoring that balance. And the same with probiotics. We should not blindly take them and think like, oh, all of this is just good. No, it needs to be customized. So maybe we can go a little bit into that, like what probiotics are helpful in certain conditions. I know, for example, like even with different types of IBS, it's important. If you have constipation, another type of probiotic will help you more likely. If you have diarrhea, that certain probiotic might not be good, so yeah, it's important to differentiate.
This is so important what you said about undertaking different kinds of probiotic therapy, or same with supplements, micronutrients therapies, because certain amounts, like with micronutrients, too high of an amount will be toxic for the body, as for example with iron, right? The WHO, World Health Organization, says, for example, that we have the iron deficiency epidemic, but it doesn't mean that like everyone should just take iron blindly, because with too high of amount it will be toxic and it can cause a lot of stress for the body. And this is the same with probiotics. I always explain it as you wouldn't just go to the pharmacy and take any kind of antibiotic for yourself, right? First thing first, you need a prescription. And for probiotics, we don't need prescription yet. As I mentioned before, all the science, all the research around probiotics is very new. So this should tell us that we should even be more cautious about what kind of probiotics we take, and always to consult it with the professional. Because I think that the good example is the SIBO, so the small intestinal bacteria overgrowth. That, for example, if we take just by ourselves without the medical consultation kind of probiotics, and they can actually, that we wanted it to help, for example, for IBS, and we wanted it to help our colon. But it will at the same time cause the overgrowth of the kind of bacteria in the certain parts of the small intestine. So this shows us how the self-treatment or treatment with Google, or okay, I will take these probiotics because one of my friends also has the constipation and it helped her, so maybe I will take it as well and it may help me. No, like remember that especially nowadays where our diseases and symptoms are so complex, so there are so many factors influencing on what's happening in the body, it is so important to individualize the treatment. Because, as you mentioned, for IBS, for two patients with IBS, we will never treat the same way. Never, because there are so many different factors that influence their symptoms, like different kinds of history, also with the gene load, same, with the psycho-emotional stress, traumas that they've been through in their life, the root cause of the systemic inflammation they have. Then there may be different kinds of central nervous system inflammation, so the neuroinflammation they have. So it's never, there are no two treatments that will be applicable for, there's no one treatment that will be applicable for two people. And same with the probiotics. So the perfect situation with the probiotics is that we test, as we mentioned, the stool test that we can do for our microbiome. Undertake the stool test and then take the specific targeted probiotic therapy. It doesn't necessarily even have to be connected with the kind of the disease that you have. It also can be a preventive kind of treatment, because as I mentioned, like most of us nowadays suffer from these biases and we don't even know that we have like these different kinds of like little symptoms, as for example with skin and so on, or we can suffer from it from our childhood. Like delivery is a major thing that is a predisposition for our later growth of our bacteria. So depending on whether we were born with caesar section or not, it will influence our microbiome for our whole life. So it's very important, even from the preventive side, to test on the microbiome.
Yeah, super important and so beautiful, like what you said, there's just not one treatment for one condition, and that's the underlying principles of Ayurveda as well. You look at every patient, every client's story differently, and you go through all the root causes, and even though the symptoms might be similar, the root might be totally different and asks for a totally different approach. And we touched on a few imbalances or like symptoms that might show up from a disbalance. I want to go a little bit more first into SIBO, small intestine bacterial overgrowth, and I also want to bring in more of your knowledge of the biomechanics, because you also work as an osteopath and you're very well known in visceral osteopathy, so how important it is also to influence our organs or the biomechanics of our organs. And I think this is something that's completely lacking from therapy approaches right now when it comes to gastrointestinal diseases. In Ayurveda we have massage too, but I feel like osteopathy, especially visceral osteopathy, that targets the organs and the connection, like the fascia, is so valuable because, as we mentioned, stress, for example, it has such a huge influence also like on tension in the body, if you suffer from trauma or just like get stressed on a daily basis, there's so much tension that can develop in the digestive system. And then it's not a question of whether like how to improve your digestion through, for example, Ayurvedic herbs, with like ginger or like some spices. Yeah, that's a good addition, but like it might not help when your whole system is into fight or flight mode, and like the whole digestive system shuts down, and is contracted, I feel like that's a very important fact to consider, like that we can do a lot with loosen up like these areas through osteopathy, for example, and that this is a major factor that can help in the therapy, especially with like something like SIBO, where we kind of we don't know how the overgrowth exactly happens or how to reverse it. Yeah, we can take antibiotics, but the question is, how did the bacteria get into the small intestine in the first place, right?
Yeah, so this is a good topic to merge these both. So condition as, for example, SIBO, and the change of biomechanics in the internal organs. So when it comes to SIBO, in metabolic, when you talk about metabolic conditions, like SIBO never comes just by itself. It's always, it needs a cause, it needs a root cause. So it usually comes from, when it comes to amount of the bacteria, it comes from the dysbiosis in the colon. In many cases, and we talk more about it nowadays, it is mistaken with SIFO, for example, so with small intestinal fungal overgrowth, when we have not too much bacteria but too much fungi in the small intestine, or sometimes with the IMO. So the difference between SIBO and IMO is that in SIBO we suffer from diarrhea, and in IMO we suffer from constipation. And these all things are going on around the small intestine, and it's species of bacteria and types of the bacteria that are there, and the disbalance that is going on there. But it's also about what's going on biomechanically, so the tension that can occur in different parts of small intestine, so the duodenum, the ileum, and in the biomechanical clinical picture, we observe the certain patterns of how the internal organs and the tensions around them behave in cases of SIBO. So for sure there will be a lot of tensions of different parts of duodenum. We have four parts of duodenum, and so patients basically claim that they suffer from the stomach pain, belly ache above their belly button, above the navel. And they have bloating in this area, and like they just feel this amazing amount of discomfort there, tenderness in the tissue. And sometimes, especially before the diagnosis of the SIBO, they claim that it is like a stomach pain. Actually, sometimes SIBO can also be mistaken with, for example, Helicobacter pylori overgrowth, right? So that's why we need all these tests. That's why we need to test for SIBO. Like the easiest test is the breathing test. But when I see patients, osteopathic patients first, with the symptoms that I just talked about in the upper abdomen, I do not only consider SIBO, even though, we have these trends in medical world now. So now everyone is talking more about SIBO and SIFO. It was more about IBS, like back in the day. So it's been changing. But this is why we are medical professionals. This is our task to find the possible root cause. So that's why in many cases testing for Helicobacter pylori is also very important, because it gives similar symptoms especially when it comes to like tenderness and bellyache, like this kind of mechanical suffering. What will also change from biomechanical side is the tension of the so-called lesser omentum. So the fold of the omentum that contains the connections between the liver and the stomach, the ligaments between them, and also with the duodenum, the first part of the duodenum. And of course, in functional medicine, we say about food first approach, and this is super important. But when we talk about the integrative approach to medicine, so we've covered here today that regular like physician pharmacotherapy approach is important, that sometimes we need antibiotics, sometimes we need different kinds of medication. Then that Ayurveda, what you do, right? So different kinds of herbs are super important. Of course, food is important, but also this biomechanics, so the tension there, and we can influence that. And of course, how I work with osteopathy, visceral osteopathy is a huge tool that with influencing the biomechanics, influencing the tensions, the dysfunctions that are there, we influence the physiology, we influence the biochemistry. Because, for example, when the pancreas is stuck, I always laugh that it is like a very poor organ, because it has so little space in there, and it's like stuck, between like the spleen and the duodenum. And, we compress it every day with our sitting posture even more. So our posture, like, of course, we can influence the internal organs through the manual treatment as we do in osteopathy. But first approach is actually our posture and our breathing, because it influences the space that we gain in the abdominal cavity. But it's super important, and what we cover in osteopathy, because we can influence that. But what I also always explain to my patients, that the breathing patterns and the posture patterns will influence your autonomic nervous system. So the nervous system that is responsible for your stress response, for your flight, fight, or freeze, and for your rest and digest. So it influences so-called vagus nerve that innervates your internal organs. And the part of autonomic nervous system is the enteric nervous system that we've just talked about as well. So the one that innervates your gut. And then the connection between the enteric nervous system and the brain is so-called gut brain axis. So the neurotransmitters that go through this pathway. So just with so simple things as our posture, we can influence the pressure in the cavities, in the pelvic cavity, abdominal cavity, thorax, our head cavity. And then with the breathing, with the certain types of certain breathing patterns and mechanisms, we will also influence the so-called vagal tone. So with the breathing, we can actually influence our response to the stress that can, on our daily basis, can cause, for example, diarrhea. We have this pattern when we have psycho-emotional stress. We have some important task project at work going on, and we suffer from diarrhea, for example. And just with changing our posture and changing our breathing pattern at the moment, we can influence that symptom. And this is what I love about anatomy and physiology, And this is what I've been bringing to the world and to the patients. This is my educational mission, that we all have the tools. So we've covered here a lot about specific testing, different kinds of approaches, like the food approach. Of course, these things require a little bit more energy, but just with changing our posture and breathing, this is such a huge tool where we can change so many symptoms, so much of our physiology. And just to finish that thought, because we talked about the food approach and the breathing approach, it is also important to know that we influence our microbiome with other lifestyle factors, like with our physical activity. It's also in the research how different kinds of physical exercise influence specific kinds of gut bacteria in specific parts of colon. Then, for example, fasting, intermittent fasting, different kinds of fasting, they also influence the growth of the so-called good bacteria. So it is nowadays, a lot of things is in the research, and simple things first, simple approaches, then a good medical professional that can guide us through specific testing and then specific treatment.
It's so important and valuable what you said. It's about posture and breathing. When I did my study on IBS, we had these two groups, and one of them changed their nutrition according to the FODMAP diet, and the other group just went through a yoga program that I designed for them. And of course, the FODMAP diet was highly efficient, because you just avoid a lot of the triggers. But the question is it really going to the root cause? And I think it's important because it's always so valuable to alleviate symptoms, so you can feel in a position where you have the strength to also tackle from other directions. Because if you're in a lot of pain, it's harder to do yoga. It's harder to do breathing, So, but what I found with the yoga group, it was designed to have elements of meditation, of yoga philosophy, of, just expanding through the torso, for example, giving those intestinal organs space, targeting the psoas muscle, which is highly connected to our gut health as well, and to the vagus nerve, in fact, So I think that's also the value of the work that you do, because it's so integrative and it tackles from different directions. And maybe you can share with us a patient story or a case that you remember, where you applied certain things that help. It can be either for IBS or for SIBO or leaky gut. I think that's always such a valuable approach, although no approach is the same, but just to give people an impression of what that could look like.
Yes, what you mentioned, every patient is different, every approach is super individualized by me when patients come to see me. So I can cover maybe not the specific case, but some of the patterns, because I see so many patients every week, both online and live when I work osteopathically. But when it comes to gastrointestinal syndromes, so I have a lot of patients coming to see me with, for example, the symptom of diarrhea, the symptom of the low abdominal pain. So that is commonly found in IBS. Then observing some of the back pain, like muscle pains in their back. Then observing also like a low mood or signals of upcoming depression, a lot of irritation, a lot of sleep deprivation, usually problems with like getting up tired in the morning, all like different kinds of insomnia. And overall chronic fatigue. So fatigue is like, I feel that around 85% of my patients suffer from chronic fatigue. And of course, it has various of reasons. In many cases, these are different kinds of anemias, usually correlated with lacking either of iron or B12 or folate. But when it comes to like these case of patients with the symptoms that I've just described, so first thing that I do when it comes to functional medicine approach is to do the blood tests. So I have these patients who come to see me for the functional medicine online consultation already need to have prepared the results of the certain types of blood tests. Then I check on the deficiencies. Also, I correlate it with the patient's history. So I have over 60 questions that I ask my patients about, from the moment of when they were born, whether they breastfed, what kind of traumas they've been through in their life, of course, what kind of chronic and acute syndromes they suffer from, whether they had, for example, car accidents. This is so important for example, the level of mitochondria that we haven't talked about today, but this is like one of the focus of my work as well. So I need to look up through all these symptoms and the history of the patient, also the history of different kinds of surgery, especially when it comes to abdominal surgeries. So many people have, for example, the appendectomy, right? So it influences, again, your microbiome. So when the patient suffers from skin conditions and, for example, diarrhea, as I mentioned, and they have symptoms or already diagnosed some disbalance in the insulin glucose hormones, then there's always a big flag for me to test for gut microbiome. So I send them, usually like the basic test that I send them for is for the amount of bacteria and yeast. And if I see already that there is inflammation, the possible inflammation going on, so I send them for inflammation markers testing. But I start with the basic one. And then I do the osteopathic testing approach. So I check on the tenderness of the tissues, I check on the cavities pressures and the difference between them. I check on different kinds of fascia movement. I check on internal organs movement as well in 4 quadrants of the abdomen. I check on the autonomic nervous system response, whether the person who comes to see me is, in the fight or flight response. Of course, I have different kinds of indicators that I read from, obviously. I test with my hands, so it's like palpation is huge in osteopathy, but this is another like huge subject to cover. And for example, if I test the abdomen and I see that there is a dysfunction in the ileocecal valve, so the junction between the small intestine and the colon, and in the blood test I see that there is a B12 deficiency. And now I can easily correlate, of course I simplify all of it, but I can easily correlate that this B12 deficiency can be caused by this biomechanical tension in the ileocecal valve, where the B12 is absorbed. Also D3, same, vitamin D3. So I know that even though I prescribe to the patient in the protocol the supplements with B12, I can prescribe to the patient certain type of diet that will level up the B12. But if this biomechanical dysfunction is there and I don't remove it with the manual osteopathic manipulation, it will have less chance to disappear. Yeah, so this is so important to know that the anatomy influences physiology. So if the organ is in the dysfunction, different types of structures, especially within the abdominal cavity, their function will be disturbed. Their physiology will be disturbed. And there are so many indicators for that.
Wow, that was so important to mention, really, because I see so many clients that like take the vitamin B12, you know, and they don't see that in the blood, or like they take the iron and they don't see improvements in their blood levels, you know. So we can work around that. We can get like IV for ferritin, or we can get an IV for B12. But the question is always, do we just like want to work around that problem forever? Because it's not only not taking up vitamin B12, you know, it has like a lot of other symptoms and issues that come with that. So yeah, thank you so much for mentioning that again. And it just like shows the holistic approach of your work. And I hope that this podcast, and I'm so sure that this episode will be eye-opening to a lot of people who are listening right now, and to might want to come and see you too. So maybe you can tell us where we can find you, how people can get in contact with you, and
Yeah, thank you. So you can find me on Instagram. It's Karo Domaranczyk Osteopathy, but it's easier to find me first via my website. So it's karoosteopathy.com, and there you have all the links to my social media. And my social media is highly educational, so this is like my extension for my one-on-one work with patients. So and I write also in English, so I write both languages. So you can find a lot of knowledge there.
Yeah, perfect. And of course, we're going to link that in the show notes too. So people can come and see you in Poland, right, for the next
4 months.
Yeah. But it's always possible to book an appointment with you online and do the consultation on Zoom for at least the functional medicine part. And yeah, thank you so much for being here today and sharing your knowledge with us.
Thank you for this very important conversation and inviting me.
I hope you gained a lot from this episode. Feel free to share this episode with someone who might be interested in this topic. Also, make sure you subscribe to the podcast and leave a review if you find it helpful. And you can find me on Instagram at dr.dania.schumann. And for Facebook, you can find me at Dr. Dania Schumann. And also feel free to visit me on my website, daniaschumann.com. It's in German, but you find a lot of articles on Ayurveda, on nutrition, on yoga. You find a quiz for your dosha type, the Ayurvedic body constitution. And you can also find out more about the programs that I'm offering, such as my teacher training to become an Ayurvedic nutrition counselor. And you find more information about the courses and the coaching that I'm offering. Thank you so much for listening, and I hope you enjoyed the episode.